Hello, everyone. Good morning, good evening, good afternoon from where you are based at this moment. Hello to all the ones joining live and also the ones watching the recording afterwards. So today we're going to discuss important topic on men's health from a pharmacy angle, supporting men with erectile dysfunction and improving awareness of prostate cancer. So welcome everyone to this FIP webinar. My name is Rúben Viegas. I'm the FIP Practice Development and Transformation Projects Coordinator, and I'll be your moderator for the session today. Today we'll have four presentations. One will be from the FIP Projects Coordinator Nour Eltahla, and she will explain a bit the equity program, very short recorded presentation. Then we have Regina Ahmed from Royal Pharmaceutical Society. We have Raj from India, and also Pablo from Spain, and they will present different perspectives, different projects, and different ideas regarding these topics of men's health. So we'll be looking forward to their presentations, and I'll present them in a minute before they actually present their slides. Few announcements. So this webinar is being recorded and live streamed via YouTube, so you can also watch it afterwards and share it with your colleagues and friends. The recording will be available on the FIP events website, events.fip.org, and you can also see previous and future events at this website. Please use the question box for questions, the Q&A. Tell us in the chat where you're from and say your greetings in the chat box. Please put your questions in the Q&A box so we can look at those during the discussion later. Please provide any feedback you have to webinars@fip.org. And if you're not an FIP member, we encourage you to join, and you can check the link below. Another acknowledgement is that we want to thank Beatrice for supporting this event through an unrestricted grant. Thank you, Beatrice. So the program is a short introduction by me, and then we'll have a presentation of the program by Nour, then Regina from RPS UK will be talking about the role of pharmacists in management of erectile dysfunction. Then a campaign from Spain, counting with your pharmacist, key to winning the battle against prostate cancer. And last but not least, the regional perspectives from India on prostate cancer awareness and management of erectile dysfunction. And in the end, we'll have some time for a discussion, maybe some questions from you, and then we'll proceed to a wrap up and conclusion. So today we would like to review current treatment options and guidelines for pharmacological management of erectile dysfunction, including different types of medication used in counseling points. So understanding a bit what is erectile dysfunction, how it works, and what pharmacists can do in this area. Also discuss screening guidelines and the pharmacist's role in education, awareness, raising and monitoring for prostate cancer. So another big topic is prostate cancer as well. And demonstrate skills to optimize medication therapy, referrals, support men in the community regarding these topics, but also other relevant men's health issues. So these are the three main objectives for today. And now we'll have a quick run through three short polls. So we would like you to engage and reply. We'll have the polls popping up at any minute. And the first one is, which one is not a key men's health issue? So we have prostate cancer, knee injuries, mental health issues, or erectile dysfunction. So we would like you to choose the one you think it's maybe not a very relevant or the most important key men's issue. So there you are. So we'll wait for maybe less than a minute for you to put your questions, your answers to this question. All right, I think we had some time for choosing those, so we'll see. The same questions will be repeated at the end, so we're also looking forward to see if you can find the answers during the presentations. So the next one is, which one is not the cause for erectile dysfunction? We have hormone problems, depression or anxiety, heart pain, or stress. So we'll focus on the second poll for some seconds. So let's see what you think. All right, I think we got some answers already, so we'll move to the last question for which of the following is not the role of pharmacists in the management of prostate cancer? So health education for community pharmacists, promotion of healthy habits, promotion of adherence, and contact physiotherapists. We look forward to your engagement and responses. Thank you so much for your engagement with these questions. We will be redoing this at the end, so we will be making sure that you can review these concepts during the presentations and get back to these at the end of the event. So the first speaker will be Nour Eltahla. She's the FIP Projects Coordinator for Equity, Sustainability, Policy, and Development. And her presentation focuses a bit on the Equity RX program. So it's a program that focuses on equity aspects. And of course, when we talk about men's health, women's health, and maternal health, these are all under the umbrella of equity. And there's just a simple presentation to highlight this program. So I'll leave you with that.
Hello, everyone, and thank you for joining us today at this very important event addressing men's health from a pharmacy angle. It's essential to highlight the importance of equity and access to health for all genders, and today I'd like to walk you through some of FIP's work in this area. The FIP development goals reiterate FIP's commitment to bettering global health through pharmacy. And these goals you see on screen, they're key resources for transforming the pharmacy profession globally, regionally, and nationally. They align with FIP's mission to support global health by enabling the advancement of pharmaceutical practice, sciences, and education, and are set to transform pharmacy in alignment with wider global imperatives underpinning the UN Sustainable Development Goals. FIP Development Goal 10, Equity and Equality, calls for clear strategies to address inequalities in the pharmaceutical workforce, widen access and equity of pharmaceutical care services, as well as equity in global capacity and pharmaceutical sciences development. As with all the other 21 development goals, Development Goal 10 is composed of 3 elements. The workforce and education element, which sets out clear strategies for addressing equity and diversity inequalities in pharmaceutical workforce development, continued education and training, and career progression opportunities. The second element, which is the practice element, sets out clear strategies for equity and diversity in pharmaceutical services delivery, service access, and service impact so that all people have access to quality pharmaceutical care. And the third element, which is the science element, emphasizes equity and global capacity to pharmaceutical sciences, training, research infrastructure, development and manufacturing capabilities, and evidence-based regulatory oversight. FIP Equity RX is FIP's equity and equality program, and it supports the progress and implementation of FIP Development Goal 10 locally, regionally, and globally, beyond gender and diversity balances, extending to equity and access to care and all that this encompasses. Operating under the motto, Pharmacy Leaving No One Behind, Equity RX is a large program encompassing many unique areas of work, all of which come together to support equity and equality for all. Development Goal 10 and the Equity RX program support the equitable access to healthcare for all individuals, regardless of the following factors: age, disease and comorbidities, gender, literacy and access to education, mental and physical ability, race and ethnicity, religious beliefs, sexual orientation, and socioeconomic status and class. With regards to men's health, equity and access are pivotal in the realm of men's health, ensuring that all individuals have fair opportunities to attain optimal well-being, regardless of their background or circumstances. And achieving equity in men's health means addressing disparities in health outcomes and acknowledging the diverse needs of different populations. It involves dismantling barriers that hinder access to healthcare services, promoting preventative care, and prioritizing mental health support. By fostering equity and ensuring access, we not only enhance the overall health of men, but also contribute to a healthier landscape that's inclusive, fair, and responsive to the diverse health challenges faced by men across various socioeconomic, cultural, and demographic dimensions. This approach is fundamental for building healthier communities and promoting positive health outcomes for men of all backgrounds. Thank you so much for listening. And if you'd like to know more about the Equity RX program, please visit the website on screen, equityrx.fip.org, or feel free to email me on the email shown on screen. Thank you very much.
So we'd like to thank Nour for the presentation. As you saw on the slide, there's a different, there's age, there's gender, there's race, so there's a lot of factors. And regarding men's health, maybe there's a difference regarding sexual orientation or race that adds a layer to the complexity on access to care on these issues. So maybe all speakers will also dive into some of these aspects while they present their work and their experiences. So without further ado, I'll just move to Regina Ahmed. She's a guidance manager from the Royal Pharmaceutical Society. She has quite a lot of experience, a very large CV on this area, and she will be talking about the role of pharmacists in the management of erectile dysfunction. So Regina, the floor is yours. Thank you so much for joining.
Thank you so much, Rúben. So hello, everybody. My name is Regina Ahmed, and I'm the guidance manager at the Royal Pharmaceutical Society, or RPS, based in the UK. RPS is a membership organisation representing pharmacists and pharmaceutical scientists working across various sectors and settings. And we're involved in advocacy and learning and professional development. So I am a pharmacist by background, and I'm also a prescriber as well. My experience is mainly in community pharmacy, general practice, and also other pharmacy organizations. So I'm here today to talk to you about the management of erectile dysfunction in community pharmacy and the pharmacist's role. So as a disclaimer, my talk is quite generic, but it will be mainly focusing on practice in the UK, as that is where I'm based. So I would advise you to contextualize the presentation to your own practice and apply any relevant legislation, regulation, or guidance in your area. Also, you should contact any equivalent organizations where relevant. For example, the medicines regulator in your country regarding the class and supply of medicines. Next slide, please. So here are the objectives today. This is what I'm going to discuss with you. So what is erectile dysfunction or impotence? Why is it a problem? And how can pharmacists help? I'm going to talk to you a little bit about prescribing, and then dispensing, supply over the counter, counselling for when you're prescribing, dispensing, or supplying, and also just briefly about the RPS resources that we have that might help you. The next slide, please. And then the next slide, please. So what is erectile dysfunction or impotence? So it's the inability to achieve or maintain a penile erection or satisfactory sexual pleasure. And it's also the loss of libido. Next slide, please. So there are many causes of ED, and it may be due to many things like stress. So therefore, it can affect any man of any age. Side effects of some medicines, for example, antidepressants, anti-epileptics, and diuretics. Certain underlying health conditions, so things like cardiovascular disease, hypertension, cholesterol, diabetes, degenerative disorders like Parkinson's, or anatomical changes. Tiredness, so it might be just temporary, recreational drugs or too much alcohol, smoking, obesity, depression or anxiety, and also hormone problems as well, like hypergonadism and hyperthyroidism or hypothyroidism. Next slide, please. So here are the medication treatment options available in the UK. You may have other medicines available where you are, and people should be made aware of all treatment options available to them so that they can make an informed choice. Now, the choice will depend on how often the person has intercourse, their response to treatment, if they have underlying factors and contraindications. And some of the drug treatments include phosphodiesterase type 5 inhibitors, so PDE5 inhibitors, I'll call them. These are things like sildenafil, tadalafil, and vardenafil. Now, what these do is these increase blood flow to the penis by blocking PDE5, relaxing the blood vessel walls. They start working in about 30 to 60 minutes. However, sexual stimulation is needed for them to work. And some of them might be affected by food in the stomach, so all except tadalafil, and that one isn't. Sildenafil and tadalafil are available to buy from a pharmacy over the counter in the UK, and I'll go into a bit more detail about that later on. Another drug is alprostadil, things like Caballero, and there's an intraurethral application called Nour, and a topical cream as well called Viteros. So again, these increase the blood flow to the penis by relaxing the muscles and the blood vessels. These are normally initiated by specialists in the hospital and then just carried on by their usual GP. Okay, next slide, please. So here are some of the non-medication treatment options available in the UK. Now, some of these actually use in conjunction with the drug treatments I mentioned before. So things like you've got vacuum pump devices. Now, these increase the blood flow to the penis, and these might be used if any of the, for example, the previous ones like the PDE5 inhibitors are contraindicated. Then we recommend things like diet and exercise. So if the person is overweight, then we recommend that they lose weight. Alcohol. So in the UK, we recommend that you don't exceed more than 14 units of alcohol a week. And that's sort of like equivalent to about 6 glasses of wine. Therapy and counseling. So that might help if it's linked to anything emotional or a mental health problem. Stopping smoking, that will really help. Reducing stress and anxiety. So you could use anything that will help you. So mindfulness, breath work, journaling, self-care, therapy, exercise, whatever. And then you've got cycling as well. So if the person cycles for more than 3 hours a week, then they should avoid it for a while to reduce any kind of pressure in the area. And also, they'd want to treat the underlying cause. So say, for example, it's hypertension or diabetes or anything like that, then they want to treat that underlying issue first. Next slide, please. So why is ED a problem and how can pharmacists help? Next slide, please. So the problem is that it's likely to affect more than 300 million men worldwide by 2025. It's often untreated or insufficiently treated because people aren't willing to come to the doctors. They might be embarrassed. They might not know who to go to go through for help. They might not know what the problem is or who to go to. It can also affect men of all ages as well, because as I said before, stress can be a cause and that can happen at any age. And it also may be an indicator of other underlying conditions in men under 60. For example, vascular, CVD, type 2 diabetes, or even depression. Next slide, please. So how can community pharmacists help? So community pharmacists are in a really good place because they can provide timely and convenient access to healthcare and treatment. You can improve the safe supply of erectile dysfunction treatments over the counter through a patient assessment. And again, I'll go through that a bit later on. You might provide screening or diagnostic services to identify risk factors and underlying issues early. So say, for example, if you run services for things like blood pressure checks or cholesterol checks or weight management, etc. Also, it's an opportunity to start conversations. So say, for example, somebody comes in for hair loss treatments and that leads to a conversation about erectile dysfunction maybe. So it just helps you to start those conversations. You can also promote self-care as well by supporting lifestyle changes. You can also review medicines as well. So if you do medication reviews, you might identify that there's a problem. And also you can provide counseling as well. So the person will have access to advice from a healthcare professional on the safe and effective use of their medicines, including side effects, any interaction with their medicines, and any non-pharmacological measures as well. Next slide, please. So now I'm going to talk about prescribing. Next slide, please. So I'm not going to go into too much detail, but I wanted to share this with you because in the UK, pharmacists can actually prescribe within their scope. So if you are a prescriber, here are some general considerations for you if you're prescribing erectile dysfunction medicines. This may differ where you are, and you should apply your local practice. So to prescribe safely, appropriately, and within your scope, you might want to follow the Royal Pharmaceutical Society competency framework for all prescribers. Now, this is a framework created by all prescribers in the UK, so that includes doctors, dentists, nurses, paramedics, pharmacists, nurses, etc. Now, this lists the knowledge, skills, and behaviours that a prescriber is expected to demonstrate to prescribe safely. Now, this document can be viewed on our website. It's open access, so you might have heard of it before, but if you haven't and you'd like to have a look, please have a look at our website. History taking. So make sure that you take a thorough history and you know what questions to ask. So, find out about their medical history, their medicines history, risk factors, social history, lifestyle, relationships as well, and about their symptoms too. Make sure you're confident with your patient assessment skills. So physical examinations, cardiovascular risk assessments, and any investigation like any blood work that you might want to do. Make sure with your diagnosis that you know what the red flags are, when to refer, and also any differential diagnosis like premature ejaculation. Management as well. Make sure you follow your local and national clinical and prescribing guidelines and identify evidence-based treatment options. So make sure you present your options and reach a shared decision. Please bear in mind that you need to keep the patient at the center of everything and they need to be involved and happy with the decisions as well. Make sure you know who to refer to and when, for example, a urologist if there's maybe cancer or anything like that, an endocrinologist if there's hypogonadism, a cardiologist for really high risk factors of cardiac disease or any mental health services as well. Make sure you monitor and review your patients, so follow up on effectiveness and things like that, and also counsel them, so inform them of how to take the medicine safely and correctly. And again, I'll go through that a little bit later in my next slide. Signposting as well, make sure you provide information. So make sure things like websites, leaflets, anything that you think would be useful to the person, make sure you provide those. And also documents. So if you are prescribing, make sure you document any decisions made, any refusals, any referrals, any discussions, etc. Next slide, please. So now I'm going to talk about dispensing. So this is if you get a prescription for a PDE5 inhibitor from a prescriber or a doctor. So in the UK, the process of dispensing includes a clinical check. So make sure it's for the right person, the right drug, at the right time and at the right dose, etc. Then we'll do a legal check of the prescription to make sure it's legally valid, you can dispense it. You'll do a label check, you'll give counselling, and you may also provide a review as well. Next slide, please. So here is a reminder of some common side effects of PDE5 inhibitors in general to be aware of. So some medicines have specific side effects. So for full details, make sure you check clinical resources in your area. So in the UK, we use things like the British National Formulary, you might have heard of that, the BNF, the manufacturer's medicines information, like the summary of product characteristics, and also references as well, like Martindale and Stockley's drug interaction. So I'm just leaving that on here. I won't read them all out to you, but it's really important that you know which ones need the person to stop the medicine and also an immediate referral as well. Next slide, please. Okay, so now I'm going to talk about interactions. So here's a reminder of some common interactions of PDE5 inhibitors in general to be aware of that may be a contraindication for use. So some have specific interactions. So again, for full details, make sure you check relevant clinical resources in your area, as mentioned before, and also the manufacturer medicines information and things like stock-lease interaction. So also use your professional judgment to regularly check interactions with people with concurrent medicines, including prescribed medicines, anything they buy over the counter, herbal medicines, vitamin supplements, recreational drugs, and also alcohol and tobacco as well, just in case that they are of clinical relevance and they need a referral to a prescriber. Okay, the next slide, please. So now I'm going to talk to you about supply of sildenafil and tadalafil over the counter because, as I mentioned, they're available to buy in the UK. So when I say supplying, I mean the following. So in the UK, sildenafil and tadalafil are licensed as pharmacy-only medicines, which means it can be sold to people over the counter, OTC, from pharmacies following a patient assessment by the pharmacist. And this is usually in the form of a questionnaire and in line with its marketing authorization. So tadalafil and sildenafil, they are indicated for erectile dysfunction in adult men over 18 years of age. This means anyone under 18 cannot buy it, but they may be able to get it on prescription, so you should refer those people. So each product will have a condition for its supply over the counter, so you should check with the individual manufacturer's product information. And you should also check with your country's regulator as well, a medicines regulator, on the licensing, sale and supply of medicines in your area. So next slide, please. So these are some of the questions, if you are selling it over the counter, that you might want to ask during a consultation. So as a pharmacist, you need to ensure that sale is it's a safe and supply sale and it's appropriate as well. So here are some general questions that you could consider asking people, and you can adapt these and apply these to your practice where appropriate. So for example, for the sale of erectile dysfunction medicines like sildenafil and tadalafil. So we do recommend that pharmacists use the manufacturer's product information and education resources available to support the supply. And there are materials available like a pharmacist checklist and also a pharmacist guide, which you may find useful as well. So for further information, have a look at the relevant manufacturer's product information. So here are some questions to ask. So who's requesting the supply? How old are they? Is it within the license indication? What are the symptoms? Could it be something else? Does it need a referral? Does the person have underlying risk factors? And you might want to discuss possible causes, contributing factors, and address any issues where you can, where appropriate, like lifestyle changes, etc. But where you can't, you might want to refer them to the doctor. Is the person hypersensitive to any of the active ingredients or the excipients in the medicine? Does the person have any health or medical conditions, and are they taking any medicines? Because you want to check things like contraindications, interactions, and any reasons for referral using the available literature that you have. Also, you want to check whether they've been supplied it before. Number one, check if they've had any serious side effects that might require withdrawal and referral to the prescriber. You want to check if there's been any improvement. Has it worked? Because if it hasn't, then you want to refer them to the prescriber. Or if their symptoms get worse, you want to refer them to. Have there been any changes in their healthcare or their conditions since their last supply, or any new medicines taken? Have they been refused the medicine at any point or told to stop it? So you want to use your professional judgment to find out why, and also decide whether it's a reason for referral. Okay, next slide, please. So now you've asked all your questions, you want to make that decision. So you want to use your professional judgment to decide if a supply is suitable or not. So if you think that supply is suitable and the person requesting it is happy to use it, then you want to provide counselling and you can supply. But if the supply isn't suitable, or if you're in doubt of the suitability, or if medical attention, investigations, or a referral is required, then you don't supply and you want to refer them to the prescriber. Next slide, please. So now I'm going to talk to you about counselling. And this is whether you're a prescriber, dispensing it, or supplying it over the counter as a sale. So you want to advise the person to read the patient information leaflet. So next slide, please, on counselling. So advise the person to read the patient information leaflet and packaging as a reminder of key safety messages. You want to discuss the following. So the medicines, what it is, how it works, and how to use it, and the importance of adherence, so sticking with it. Side effects, so make sure the person knows what signs and symptoms to look out for and when to seek medical attention and advice. Make sure the person is aware when to see a prescriber, including any reviews that might be needed. Make sure the person knows to check interactions with a pharmacist before starting any new medicines. So that includes avoiding grapefruit juice and recreational drugs, and any kind of like vitamins and minerals as well that they decide to take too. Next slide, please. So here are all some other counselling points to consider. So if you haven't already, try and identify any risk factors and share information where possible, and encourage self-care to improve quality of life and, for example, preventing any future cardiovascular risks. Alcohol, advise them not to drink large amounts of alcohol before sexual activity, because this can temporarily reduce a man's ability to get an erection. The effects of driving, so the medicines mentioned can cause dizziness and drowsiness. Health promotion, provide lifestyle and well-being advice where appropriate, including diet, exercise, smoking cessation, reducing alcohol and stress, etc. Alternative treatments, make sure that you provide information on alternative treatments so that they can make an informed choice on the condition as well. So explain their condition to them and what causes it, to empower the person to understand their condition. And also offer sexual health advice. So if it's required, that is. If it's not, don't worry. But if it is, make sure you signpost and you know about the services available in your area. So just keep a list nearby. And further supplies. So make sure that they know how to get further supplies. Next slide, please. So just a few other considerations. So record keeping, make sure if there are any refusals or anything that you think is important, make sure you add it to their records and keep a record of it if you need to. Online purchases. So with more and more people buying medicines online, it's really important that pharmacists highlight the risks of purchasing medicines online. So if they're buying it from an unregulated source, the medicine may not be tested for safety or effectiveness. And also advise the person to check that the medicine is being supplied from a reputable provider before they buy it. And finally, you want to tell them about safe storage and disposal. So in the UK, we recommend that everybody brings back their old medicines and we dispose of them in the pharmacy correctly and safely. Okay, next slide, please. And finally, I've got my top tips. So first thing is educate your pharmacy team. They're usually the first point of contact, so it's really important that they feel comfortable about having those initial conversations and knowing when to refer. Use available resources like the manufacturer's product and educational materials. Make sure you develop good communication skills, and this will really help support and initiate your conversations. Remember that discussing symptoms of ED can be really uncomfortable for some people. So some people may feel nervous approaching the team. So ensure their comfort and confidence in you. Make sure that you are discreet, you are non-judgmental, and you put that person at ease. And one way you could do that is provide a private room for confidentiality and to have those discussions. You might also want to display some leaflets. So if they're not ready to talk to you, you can just hand them a leaflet and say, come back and talk to me if you want to, or they can just self-select. And another thing, the final thing is always use a patient-centered, holistic approach and encourage them to get involved. Not every patient is the same, their situation isn't the same, their reasons aren't the same, so just treat everybody holistically. So that's the end of my presentation, but I just wanted to briefly tell you about the RPS resources that we have that you may find useful. Next slide, please. Next slide, please. So this is what we do for our members. So here's a bit more about who we are and what we do. We do actually welcome international members. So if you'd like to join as an associate member, I can put the link down in the chat for you, just so you can have a look at that in your own time. And then the final slide. So these are some of the resources to support you with erectile dysfunction. So these are some of the practical how-to guides that we've published for our members, which help them when they're supporting people with ED. So we've got a sildenafil and tadalafil guide, because as I mentioned, we can buy it over the counter. You can access these guides 24/7 online, and they just support your day-to-day practice. We've also got guides to help you with your consultation skills, medication history, prescribing, and using your professional judgment. So yeah, if you've got any questions at all, I'm happy to take them in the chat as well. Thank you so much. That's it from me. Back to you, Rúben.
Thank you so much, Regina. That was truly a masterclass on erectile dysfunction. So that was a very, very insightful presentation. I would probably ask you not now, but in the Q&A, Also, first, if you have some more examples for it, because I'm thinking about my own experience in community pharmacy in Portugal and Spain. Of course, we don't have the prescription, and it's a bit different, but there were some situations where patients would come, and some of the factors you mentioned here were important: the privacy, the non-judgmental aspects. So if you also have any questions for Regina, please put them in the chat box. I also advise the panelists, if they have a question directly to them, that they can also write in, provide an answer in writing, and then we'll get back to it at the end. So Regina, thank you again so much. We'll have for sure some questions for you at the end. But for now, we'll move on. Make sure we have time for everyone to present their experiences. So the next one is Pablo Caballero Portero. He's a scientific dissemination technician from the General Pharmaceutical Council of Spain, and he'll present very interesting initiative, Counting with Your Pharmacist, Key to Winning the Battle Against Prostate Cancer. So we had first presentation focusing mostly on erectile dysfunction. Now we'll shift a bit to the prostate cancer aspect. So Pablo, thank you so much for joining, and the floor is yours.
Thank you so much. It's a pleasure for me to be here with all of you virtually on behalf of the General Pharmaceutical Council of Spain, talking about these issues that are of great relevance nowadays. Specifically, I'm going to talk to you about the role of the pharmacist in the care of the patients with prostate cancer. First, I'm going to talk to you about some key concepts that are basic to understanding the features of this disease and how it develops. I think this is essential if we want to establish a relationship with our patients. Then I'll say just a few words about the epidemiological relevance and the risk factors affecting prostate cancer. Is it a relevant disease? Is there anything we as pharmacists can do about it? Does it matter nowadays? Well, I will briefly discuss why it does matter. After that, I will comment on the main characteristics of the pharmacological treatment of prostate cancer. And after all this, I think that it will be easy to understand the great variety of functions that pharmacists can play as health professionals in relation to prostate cancer. As any other neoplastic process, prostate cancer is a complex disease involving numerous elements of biological nature, as well as social and cultural factors of the individual. We can differentiate between low, intermediate, and high-risk tumors. Low and intermediate risk tumors are confined to the prostate, and the main difference between them is the PSA levels. PSA, or prostate-specific antigen, is the main biomarker for prostate cancer, though it is not indeed a marker of prostate, though it is indeed a marker of prostate growth. Thus, the levels of PSA will also increase in other conditions like benign prostatic hyperplasia or with prostate enlargement that naturally occurs with aging. Conversely, high-risk tumors extend outside the prostate, and the levels of PSA are usually higher, thus indicating an important overgrowth of the gland. Most patients will be asymptomatic at diagnosis. The most frequent symptoms of patients are increased urinary frequency and urgency, similar to those experienced in patients by benign prostatic hyperplasia. The existence of distant disease may reveal other symptoms at the site of metastatic involvement, the most frequent being the bone with pain. The vast majority of patients will be diagnosed, fortunately, in early stages of the disease. In these localized stages, the usual intervention is radical prostatectomy, which involves a removal of the prostate gland together with the seminal vesicles. On the other hand, in patients with advanced disease, palliative treatment is established to increase their survival and improve their quality of life. Within advanced disease, it's necessary to differentiate between the two steps of the natural process of prostate cancer: a first phase of hormone sensitivity and a subsequent phase of castration-resistant phase, since the evolution, treatment, and prognosis will be different between them. Approximately 1 in 6 men in Spain will suffer prostate cancer during their lifetime. This probability increases with age, since 9 out of 10 cases are diagnosed in men over 65 years of age, and because of this, the incidence of this disease is higher in developed countries where life expectancy is also higher. This type of cancer is the second most incident cancer worldwide, the third most prevalent, but the 8th in mortality. And this is related to high survival rates. This image from the Global Cancer Observatory shows that despite the high incidence of prostate cancer, its associated mortality is relatively low. Look, for example, at the case of lung cancer or liver cancer, where the incidence and mortality bars are practically the same length, indicating a very high mortality rate. Fortunately, 5-year survival is 100% for localized and renal tumors, but it drops to 34% in the case of disseminated disease, which reflects the importance of early detection. As previously suggested, age is the main risk factor for developing prostate cancer. An advanced stage is clearly associated with increased risk of suffering the disease, and conversely, it is rare among males under 40. Other identified risk factors are race and genetics. This type of cancer is more common among Black or African American individuals than among Caucasians or Hispanics. In terms of genetic factors, it is known that the risk of developing prostate cancer doubles in men with one or more affected first-degree relatives. In addition, alterations in DNA repair genes such as BRCA1 and 2 or ATM are associated with its appearance and the more aggressive course of the disease. There is a problem with these 3 factors that I just mentioned, and this is that we cannot do much to modify them. This is different with other identified risk factors, namely diet, smoking, and obesity. Regarding diet, there is evidence of an association between the consumption of animal fats and the risk of developing this type of cancer, while diets rich in vegetable products seem to have a protective effect. Tobacco use is associated with both the risk of developing prostate cancer and with a worse prognosis and outcome after the diagnosis. In relation to obesity, although there is an association between this condition and prostate cancer, the underlying mechanisms are not fully understood. It has been postulated that insulin-like growth factor type 1 and alterations in sex hormones associated with obesity could be mechanisms linked to the risk of developing the disease. And what can be said about the pharmacological treatment? Well, advanced prostate carcinoma is an example of the pharmacotherapeutic advances in medical oncology in recent years, when there has been a proliferation of both drugs and treatment strategies. In addition, the excellent toxicity profile, for example, of anti-androgens compared to classic cytotoxic treatments is remarkable. Until 2011, docetaxel was the only drug approved for the treatment of patients with castration-resistant prostate cancer. But in recent years, a large number of drugs has been added to the therapeutic arsenal following approval by the different regulatory agencies. And in addition, the treatment of these patients is approached from different therapeutic strategies, such as blocking the androgenic pathway, cytostatic treatment, and bone-directed therapy. Maybe talking about the pharmacology of the different active principles would be outside the scope of this event, but I would like to emphasize that the vast majority of approved treatments, at least in Spain, are available at community pharmacies. So the role of community pharmacists is particularly relevant. High incidence of prostate cancer highlights the importance of prevention, early detection, and treatment. In this sense, the proximity and accessibility of the pharmacist to the citizen makes the implementation of the healthcare task of these professionals easier. In particular, it is advisable, not just for prostate cancer, to moderate the consumption of animal fats and red meat, to practice regular physical activity, to maintain adequate sexual hygiene, and to avoid both smoking and moderate alcohol consumption. Nutritional advice is important in these patients as it helps to reduce complications, optimize the response to treatment, avoid early death, and above all, improve the patient's quality of life. The assessment of the evolution of the nutritional status can be carried out from the pharmacy in a simple way through tools such as the mini nutritional assessment, which measures involuntary weight loss. The collaboration of community pharmacists in the early detection of prostate cancer is fundamental, since an early diagnosis can have a decisive effect on its treatment and evolution. Therefore, it is important that pharmacists can detect any possible signs and, if necessary, recommend a visit to the family physician or urologist in order to confirm or rule out an initial suspicion. However, prostate cancer is generally asymptomatic in the early stages and may not produce symptoms even if it has invaded other adjacent structures. Clinical symptoms are often related to the presence of bone metastases, such as pain, fractures, or spinal cord compression. Taking into account that the risk of prostate cancer correlates well with age, and that therefore its incidence is higher in the elderly patients who are often polymedicated, it is of special importance to offer a personalized dispensing service and to promote adherence to treatment prescribed by the physician. The patient or caregiver can be offered pharmacotherapeutic follow-up that includes a warning of the possibility of dangerous drug interactions. In this regard, it is essential to avoid taking any medication that has not been prescribed by the physician, even if it is of common use. While it is true that the level of adherence is usually high in patients with this type of pathology, because they are generally aware of its severity, adherence could be lost in the long term. So the pharmacist should emphasize the consequences on health, which can range from a worsening of quality of life to a lack of control of the disease or a greater likelihood of complications, side effects, or comorbidities. It is important to counsel patients about the possible adverse events that can occur during treatment with drugs specifically indicated for prostate cancer. Most patients experience loss of libido and erectile dysfunction. This can significantly impair quality of life, and in these cases, the use of drugs that help achieve an erection, such as phosphodiesterase type 5 inhibitors, sildenafil, tadalafil, vardenafil, we just heard of them, could be considered and always in Spain under medical prescription. Finally, it is worth highlighting the importance of communication with a patient undergoing oncology treatment, especially given the proximity we have from community pharmacies, encouraging active listening and empathy. It is important to find out their degree of information and, for example, how much they already know about their disease and how much they want to know. Finally, to sum up, as a compilation of all that has been said so far, I believe that there are 4 main ideas that are worth pointing out. First, prostate cancer has a high incidence and causes a significant impact on the quality of life of patients. Second, although we cannot act on all the known risk factors, there are others such as diet, healthy lifestyle habits, or weight on which different interventions can be established from the community pharmacies. Moreover, new pharmacological treatments have recently been incorporated that favor the control of the disease, and in many cases, allow to reach a life expectancy similar to that of the general population. And pharmacists, especially community pharmacists, play a key role in early detection, in the management of the pharmacotherapy of the disease, and in improving the quality of life of patients. Thank you.
Thank you so much, Pablo, for your presentation and seeing how community pharmacists can contribute to this important topic of prostate cancer. And also, as Regina also said, there's a room for improvement in the non-pharmacological factors, so diet, exercise, all these we can change, because not only for these conditions, but also for others, it's also important. So if you have any questions for Pablo, just drop them in the Q&A. I also asked Pablo and Regina to see if there are any questions there for them. So they can provide the written answer while we listen to the last presentation. So we have Raj Vaidya, is a community pharmacist from India, from Hindu Pharmacy. He's also the community pharmacy section executive committee, so he's very involved in FIP. And we'll hear from a regional perspective from India on prostate cancer awareness management or erectile dysfunction. So Raj, thank you so much for joining and for presenting your experiences and your points on these two important topics. The floor is yours.
Thank you. Thank you very much to FIP for giving me this opportunity to speak. I will talk in general about the awareness of prostate cancer and erectile dysfunction in the Indian perspectives. The previous two speakers have given wonderful presentations and highlighted the more specific roles of the pharmacists. Next slide, please. Thank you. India is the largest populated country in the world with 1.4 plus billion population. We have 51.59% males. That's 717 plus million. That's a huge chunk of male population. And in the age group of 15 to 64, there are around 68% of males are in this age group. So, and less number of the elderly. Of course, the middle age group is growing, and the problems that we are discussing are also increasing. Next slide. The Indian healthcare system is quite complex and diverse. It's a mixed network of public and private sectors with a lot of stress on private sector, unfortunately. And in spite of largely significant progress, especially in the past decade, and the initiatives taken to improve the healthcare system, still we are left with multiple health challenges. One of them is inadequate infrastructure, that is in terms of healthcare facilities, as well as a shortage of healthcare professionals. Now, there is a huge disparity between these two in the urban and the rural areas, and it differs from state to state. So there is quite a lot of disparity. So in the metro cities and the larger cities, there are better infrastructure, better availability of the private sector, and better detections of many of these things. Then the public health funding is quite insufficient compared to the other countries. It's only 2.1% of the GDP. So the public health funding contributes around 30% of expenditure for health. And only around 37% of the population is covered by some or other form of health insurance. That's much less compared to many other countries. Next slide, please. This is relating to out-of-pocket expenses and the private and public sector. As mentioned earlier, the private sector is more dominant in the healthcare sector, catering to around 70% of patient visits. It's around 60% for outpatient, and inpatient is around 80%. The public health sector offers healthcare at no cost or low cost, but yet there are lesser visits, around 30%, especially in the urban pockets. The rural pockets are more amenable, and since there is less of private sector, the rural pockets access more of these public health sectors. Around 50% of the healthcare expenditure comes from out of pocket, so the public pay for it from their own pockets, and in some states this is considerably higher. Of course, in the last 10 years, this expenditure has luckily reduced considerably. Next slide, please. So coming to prostate cancer in India, in 2006, it accounted for the 5th highest incident rate among males in India. That is around 4.8 per 1 lakh. And of course, this was a significant increase from the year 1990. So it's almost 30% increased in levels of prostate cancer in these 25 years. It is often presumed that the prevalence of prostate cancer in India is lower than in the Western world. But it is, of course, but it is soon changing gradually with there are a lot of cancer registries in different parts of our country, and they are showing increasing number of enrollments, that is increased number of detection, and is showing a rapid rise in the number of cases. Next slide, please. The top government medical research body, that's the Indian Council of Medical Research, has reported an incidence rate of 9 to 10 per 1 lakh population, which is of course higher compared to other countries in Asia and Africa, but still it's lower compared to the developed countries like in the United States and many European countries. In addition, studies have found that developing countries have more patients in advanced stages as compared to the Western world. This is because besides delayed detection, even the quality of care is comparatively less. So that's why, in spite of lower incidence, the survival rates for prostate cancer is relatively low in Asian countries, and the same applies to India also. Next slide, please. Now, the recent increase which we are seeing in prostate cancer incidence in the country is mainly attributed to, one of them is migration of rural population into urban areas. There is a lot of migration because slowly rural is moving into urban. The other thing is huge change in dietary habits and lifestyle habits. So that has also contributed considerably. And of course, there is an increased awareness and easier access to medical facilities in urban areas. So that is why there is higher number of detections, especially in the urban areas. India being a vast country, there are marked differences in, excuse me. Sorry. There are marked differences in detection practices, access to healthcare, affordability, and availability of treatment modalities across different regions, because it differs region to region. Next slide, please. So management of prostate cancer in India is considered difficult because of these several factors. One is the overall low awareness about the disease, varying access to medical care, late diagnosis. The simple test like the PSA is relatively costly, say $10. So some would feel it costly, some would not. At the same time, there is no awareness about the importance of doing a PSA test, especially for those male adults above 50. It's a simple test, yet sometimes quite often not done. There is inadequate documentation about the incidences of prostate cancer in the country, and there's a lack of robust prostate cancer data in Indian patients. Next. So these are some of the activities, promotion activities which are carried out by the private sector, the larger hospitals, promoting earlier detection for prostate cancer, which in turns into increasing number of detection as well as increased number of surgeries, so that they can promote their hospitals as well as provide these surgeries. Next. This is another example where the private sector does a lot of publicity and promotions. One is for awareness, other is for prevention, as well as for early detection, so that they can get increased numbers can be detected. These are also some of the other corporate hospitals. Yes, next. So these are another examples. So what I have presented to you is a multiple number of corporate hospital, private hospitals, which are more into doing such type of publicities in different sectors. This is mainly in the metro cities and the urban areas. Next slide, please. So the Prostate Cancer Awareness Month is also again an activity conducted by the Urology Association and the Cancer Association, as well as the private hospitals, for creating awareness amongst this. Next slide. So what I have envisioned as a role of the pharmacist, currently we are not able to play the role as presented in the earlier presentation, but it's definitely an eye-opener, and we should be moving into this activity for increasing the role of the pharmacist, because very often the pharmacist received as a first port of call many ailments, and this includes men who complain of lower urinary tract symptoms. So that is why it is very important. Pharmacists need to be trained or equipped to guide patients. So pharmacists first need to be equipped themselves so that they can handle the patients in a much better way. So one of the things is that referral of patients for timely cancer screening, especially those with symptoms or those who are having age 50 and above, to do their PSA test once in a while, assessment of risk so that there is early detection for these patients. Then educational interventions are very important so that pharmacists can promote preventive measures in general for cancer as well as for prostate cancer, and that includes diet and lifestyle modification, maintaining a healthy weight, stopping smoking, and reducing alcohol intake. So the pharmacists need to be more active in creating such sort of awareness. Next slide, please. And now I move into the part on erectile dysfunction in India. Now, despite the obvious prevalence or apparent prevalence, we have very few epidemiological studies in India relating to ED. So various studies have been carried out, but they are either locally or regionally, and they are smaller studies. So there is a lack of data on the prevalence of sexual disorders, concrete data from any large-scale epidemiological studies in the country. Next one. So even so, it is quite common, and especially coming from those physicians who are specialized in this field. From their mouth, as they see the number of patients, they are able to give their idea about the estimates, probable estimate that could be there. So erectile dysfunction has increasingly become common in younger men as well, and this is quite alarming. It is, of course, very concerning, as it suggests that ED is on the rise and may soon become an epidemic. Next slide. So the various contributing factors, and this is also more specific to India because it is worldwide, is especially among the young men, is about the lifestyle. Because of technology, use of gadgets, and so many various things, the lifestyle has become more and more sedentary. Unhealthy diet has crept in, and there is increase in intake of alcohol and smoking. And of course, there is substance use disorders, and there is high levels of stress. So all of these things lead to the contributing factors for prostate cancer, and that's obesity, high blood pressure, heart disease, diabetes, all of which are known factors for ED. So the younger generation is also facing a lot of emotional and psychological stress. There's a lot of pressure to succeed in their career and as well as their personal lives. So both adding to each other, and this leads to very high levels of stress and anxiety. And this definitely affects men's sexual health, leading to erectile dysfunction at earlier ages. Next slide. So India is well known by now that it's a diabetic capital of the world, largest number of diabetics. At the same time, a large number of diabetics do not know that they are diabetics. So quite often Because of their erectile dysfunction, they are diagnosed to be diabetic. So this percentage of cases, somewhere 8 to 10%, do also occur. And besides that, the largest population of males in the world is in India. So quite a lot of experts, sorry, from this field are quite openly saying that India has become the importance capital of the world, in both in terms of incidences as well as in the prevalence rates. So there are estimates that importance affects around 50% of males above the age of 40. So this is quite alarming and it needs to be seriously worked upon. Next slide, please. So most commonly, what is available and prescribed is sildenafil and tadalafil. So dapagliflozin is also there. On the right-hand side, you see a picture of a carton of tadalafil, and at the bottom, you see in red the caution. So both sildenafil and tadalafil are strictly by law not to be sold unless we have a prescription of a urologist or an endocrinologist or a psychiatrist or a venerologist or a dermatologist. So other than these, nobody is allowed to prescribe by law these sort of medicines. So definitely these are strictly prescription medicines. But and of course there are plenty of brands available. India is the pharmacy of the world, and India is able to make large number of medications at much lower rates and in large numbers. So at the same time, there is a offshoot to that, and unfortunately, these medicines are available without a prescription. Unfortunately, they are sold without prescriptions in many places, not only in pharmacies, but also in places they're not even supposed to be stocked. And also, they are largely illegally sold online. So, these are actually worrying factors because if these medicines are not used correctly, as was described by the previous speakers, they're going to be having problems. So largely these medicines are misused or wrongly used. That's what is the picture is coming up with. The next slide, please. There is a need for better control in the regulation in sale of these medicines. Now, other perspective related to talking about sex and sexual problem is that talking openly about these issues is quite a taboo in India, especially in various strata of society. And this is across the spectrum in the country. And of course, there is a lack of awareness and open discussion, no open discussion on sexual health. And this makes it difficult for people to seek out help in case of sexual problems. So many times they remain suppressed, health issues are ignored, even these issues are ignored, kept to oneself, and often until it is too late. So the health seeking behavior definitely needs to be improved. And there is also an insufficient number of healthcare providers, doctors, especially related to ED, as well as cancer. Next slide, please. So now, because of this, what also is very attractive is the large number of herbal products which are promoted very widely. I've just put up two examples, two pictures for you, which are advertisements from the internet. I just picked them up at random. So these are the sort of things that these medicines are claiming to provide. Increased performance, longer lasting, increased power, enhanced desire, enhances sexual performance. So these have sort of correctly gauged what is the problem. Next slide, please. But what is also on the other flip side is that besides there being hundreds of such advertisements and promotions, maybe even thousands, internet is full of them. The newspapers are also full of them. The television channels, the private channels, there are testimonials from people talking about the good about them. And so it's largely publicized. So this seeks to trap these people, these individuals who are not coming forth with their problems to healthcare providers. The other problem is about what is the real content in this, how really clinically effective are these products, and what is the safety of these products. And on the other hand, the cost of these products is very high. So there is every possibility that they may give placebo effects, but in spite of spending so much of money on them, they may not probably give the good effects or the desired effects that the people may be seeking. Next slide, please. So here I see the role for the pharmacist. We do get a lot of clients seeking advice on sexual health. So that is why it's very necessary that pharmacists be better equipped to have knowledge about these issues, and so that they are better equipped to guide, counsel, and refer the patients who are having erectile dysfunction and related disorders. They can guide them, counsel them about their lifestyle, about the diets, and when to refer them to the respective doctors. Pharmacists can create more awareness on ED and amongst their patients through the pharmacy as well as through social media. This is again very important and presently a large role that a pharmacist can play. And we should be working about how to enhance the role in terms of maybe one step further would be how patients can actually start to give guidance. Because just like the UK, it's still not yet OTC. So the pharmacists need to work towards it to be better equipped. I think that's my last slide. So thank you everyone for a patient hearing and allowing me time to present myself. Thank you.
Thank you so much, Raj, for this presentation and to let us know how the situation is specifically in India. So I'll ask all the panelists to open their cameras, and also we'll have time not for a lot of questions, but for some questions. So I'll start with Regina. So there was a question about switching to OTC. So and we saw in Raj's presentations that there's a problem of buying it illegally online, maybe through friends or through other means. So do you think that having these OTC makes it easier for the pharmacists when it comes to access to this type of medicines? How is your experience? Do people still look for them outside, online, or by other means?
Sorry, I think for convenience, it's all about knowledge, isn't it? So a lot of people think it's easy access to buy online, and you'll always get people who just think, I'm just going to buy it online because it's easier. So I think it's about making sure that the pharmacist, it's important that people know the benefits of coming to their pharmacy, because if they go to a pharmacy and the pharmacist isn't friendly, the team aren't friendly, they can't talk to them, they make them feel embarrassed, they're not going to go back there, are they? So if they have really good communication skills and they make it the norm, that they can come to them for things like erectile dysfunction, especially if they're a bit embarrassing topics or topics that aren't easy to talk about. I think the one main thing is that they have access to a healthcare professional as well, because also when you want to make an appointment with the doctor in the UK, especially, the waiting time can be quite long, and you don't want to wait a whole month and your relationship is suffering because you're having this problem. So by going to your local pharmacy, it's just easier access. So it's just making people know about the positives and the benefits of going to your local pharmacy rather than getting it from online, because when you're online, you don't know what you're getting. So it's just about spreading that knowledge and that information. But yeah, I think a lot of people benefit from the fact that they can access it in their lunch break or go after work, or even online pharmacies. They can just, get it online, typing in a form, a questionnaire, and then they can get it sent by post as well. But these are all from registered pharmacies that I'm talking about, rather than from dodgy websites. So yeah, it has been really helpful.
Yeah, I think in some countries it's still complicated because there might be access through other means that are not maybe as legal or as safe as a registered pharmacy. So there's probably, from Raj's presentation, we can see there's still probably a lot of work in that area, at least from India. And I'll go to, I think, Raj, you also have some questions in the chat box that I'll go to you after. But for now, I'll just ask Pablo. I saw in the question that you said like the General Council has some resources or some things on this area. So can you maybe let us know what the Consejo, the Council, has been doing regarding specifically the prostate cancer, if you have any examples of resources?
Yeah, the General Council, Pharmaceutical Council of Spain, with its Department of Assistential Pharmacy and Formation, has a lot of resources for pharmacists in Spain to give them proper information about the topic and how to manage patients there. And colleges in Spain also have more resources, and in different regions of Spain, pharmacists can make some offer some services for patients, like counseling, but more specific services. But this depends on the specific region. But we offer information for pharmacists and a lot of resources that are also useful for general population, but are directed principally for pharmacists.
Perfect. Thank you so much. I think it's nice for pharmacists to have some support, because there's, of course, many areas where pharmacists can work and provide advice and everything. So if there's some support, some materials, I think that makes it easier for pharmacists, of course, to provide this advice or to remember. Like Regina said, maybe there's a flyer as well, and people take it and they come back when they're ready. So all these resources are also very important for the practice. So Raj, my question is following this up. Do you have any? We saw some examples of the hospital and the private clinics doing this kind of campaigns. Is it also possible? Is it also common that pharmacies have this kind of campaigns, or is it hard for pharmacies to get into this campaigning and talking to the people? So, is there also some examples on this from pharmacy point of view, or is it hard for fun?
No, we don't have examples, but it is not difficult, especially if the promotional material comes from the association. Pharmacists can always pass it on. The use of social media is very useful. So when other campaigns do happen, pharmacists are participating in passing on this information. So when information about these also comes forward, I'm sure we'll be able to push it through the pharmacies and through the associations. So that's a very good thing to do. And I think we will start that.
Perfect. That makes a lot of sense, that the pharmacy associations can also provide support to the pharmacies in their country. I think we're reaching the end, because we still have the last logistics. So I would ask each of you to provide a final message, maybe 1 minute message of a highlight you want to give, or some ideas that you want to capture for this last moment. So I'll start with Regina, and then Pablo, and then Raj.
So am I on mute? Let me just check, sorry. Yeah, so I think my main points, I've mentioned them in my top tips, sorry. It's really important that you educate not only yourself and your team, to make sure that you understand the condition itself, you understand the barriers that people face when getting treatment for it, you understand the problem if people aren't treated. You also make sure that you use the resources available to you, because there are so many, and mainly it will be your communication skills. So I think it's really important that if you improve and develop your consultation skills and your communication skills, so through your body language, etc., then that will really, really help with bringing those patients in to the pharmacy and getting the treatment they need for erectile dysfunction.
Perfect. Thank you so much. Pablo?
I think regarding prostate cancer, it's important to make population conscious that this is a very, very benign, if we can say this way, type of cancer, because most of them, almost 100%, are curable diseases if they are detected on early stages. So I have to say to people, we as pharmacists have to say to people that they can go to the urologist. Maybe it's always controversial for some people, but it's a curable disease. So we have that luck, we have treatments, effective treatments, and it's important to raise awareness of the importance of the early detection and the effectiveness of the available treatments.
Perfect. Thank you so much, Raj. Any
Yes,
final
for
ideas?
both of these things, preventive measures is most important. So we need to continuously stress the healthy lifestyle and dietary habits. That is most important. And side by side also promote early detections. Because early detections can help definitely a lot. Both we can control the lifestyle as well as if detected early, prostate cancer can be treated 100% cure. So these are important things that we as pharmacists need to move forward.
Perfect. Thank you so much. So there's maybe still a couple of questions left. If you have some minutes, I'll ask the panelists to still go through them while we do the wrap-ups and the final polls. But as a main summary, I would say that we have two big priorities. So in this webinar, it was erectile dysfunction and prostate cancer. We saw that erectile dysfunction is growing in younger populations due to stress, but also due to other causes. So it's becoming more prevalent. And as pharmacists, we can, if we're in the UK, we can also go to the point that we have OTC available, but maybe in other countries we don't. So we can do lifestyle modifications, we can do advice. We need to focus also on the privacy because it's a sensitive topic, not probably for some people. So there's quite a room for pharmacists to engage in erectile dysfunction, even in a younger age. Regarding prostate cancer, we saw that it's becoming more and more prevalent. So we have more older people, so we have more likelihood of having this type of conditions. But luckily, it's a very nice condition, so to say, if we get them early. So there's a lot of room in opportunities for screening. From my experience also in Spain, there was screening for colon cancer, for example. So there's also the engagement of pharmacists in screening and early detection. And if we can do this, then with a referral to the urologists and the other healthcare professionals, we can make sure that there's a expected lifestyle, an expected life ahead for these people. And regarding both conditions, there's a strong influence of lifestyle risk factors that was mentioned in all the all the presentations. So there's room for behavior change, making better life choices, tobacco use, less tobacco use, better food, and more exercise. So these are things that pharmacists can do on a daily basis and will not only contribute to these mental health issues, but also for other conditions like diabetes. So there's opportunity for pharmacists to engage in campaigns and in conversations. And this, I think, is a very positive summary and idea for the end of this event. And now we'll have the same polls again. So we have minutes or so to run again the questions. So which one is not a key men's health issue? And you have the four options, and we'll leave you some seconds to reply. Perfect. So we have some questions, some answers in, and we'll go to the next one. Which one is not a cause or a major cause for erectile dysfunction? And you also have the four options. So we'll give you some extra seconds to go through it. Perfect. So we have a final question for today that focuses on maybe a not major role for pharmacists in the management of prostate cancer. And again, we'll give you some minutes, some seconds, maybe a minute to respond. Okay, thank you so much. We got most of your inputs for the both questions, beginning at the end, and we hope you had a nice time joining this FIP digital event, that you could learn something about men's health, and to thank again Regina, Pablo, and Raj for joining, also Nour for sending the short overview. So this was very informative, and you'll have the recording of the event. If you want to check back some of the things, you can go to the recording and pause and read some of the references. For example, this is all available in the events.fip.org, and you'll see there are also more events, so stay tuned for further events for FIP. There's usually a big offer in diverse topics presented in this event. So thank you very much again for all that could join today, and we hope to see you again in more FIP digital events. Thank you so much.
Thank you.
Thank you.